Good morning. I'm Dr. Dale Bratzler. I'm the University Chief COVID Officer and the Enterprise Chief Quality Officer here at OU Medicine. It's really a pleasure to be here this morning. I'm going to give you a quick update of where we're at in Oklahoma with respect to the pandemic, and then discuss a few other items that I think are important to think about. So the first, as I think most of you are aware, we're at a new peak in the pandemic in Oklahoma. We're just under 80,000 cases of COVID-19 that have been confirmed since the onset of the pandemic in our state, and we've had 962 deaths. We had 7,700 new cases reported just in the past 7 days, which is way up. We've had almost 1,000 cases every day, 5 out of the last 6 days, and 50 deaths that have been reported in the last week. So if you look at our 7-day rolling average of new cases, we're at the highest level we've ever been, just over 1,100 new cases on a daily basis. So we've seen substantial growth in the number of cases. When we look at some of the other metrics, of course, Oklahoma County and Tulsa County, because they're the big population centers in our state, always have the cumulative most cases. But one of the things I've been noticing over the past couple of weeks, looking at county level data, is that the actual prevalence rate by population has gone down substantially in the metroplex areas, and we're seeing growth of new cases by population in rural counties. Of course, everybody's aware that there have been some correctional facilities with large outbreaks in the state. So on Monday of this week, when we had 1,100 new cases reported in the state, almost 400 of those came out of a single county, Woodward County, which is where they're seeing this large outbreak in the correctional facility in Fort Supply. So the numbers, the big jump in some of the numbers is, as the governor mentioned yesterday, is related to correctional facility outbreaks that have been happening around the state. Same thing happened in Veneta, Oklahoma, so Craig County has had a substantial rise. But again, when you look at the population-based prevalence of COVID-19, the new cases in the state, there's a real growth in rural communities with the larger metropolitan areas having slower growth of new cases. When I look at testing data, we're positive. That gives me a stable estimate of the number of percent positive tests since the start of the pandemic. And this past week, we were down to about 8.5%. And so far this week, we had one day that we were at 11% and one day that we were at 7%. So I don't have enough data yet to tell you where we're at this week with percent positives. We'd seen a slow trend downward in the number of tests that were positive. Of course, we may see some uptick with the correctional facilities that are having outbreaks in the state. Hospitalizations are way up. We jumped 106 hospitalizations from Friday until Monday in the state. Of course, yesterday in the press conference, they suggested that some of that jump may have been due to underreporting by hospitals in those previous weeks. I don't know what proportion, but I do know that there have been transfers of COVID patients around the state, principally because of the outbreaks in correctional facilities. So I think there is some uptick in the number of people who are actually in the hospital with COVID-19. And as I've pointed out in multiple press conferences, we still have more than 200 people in the hospital each day in our state that are in the intensive care unit with a confirmed diagnosis of COVID-19. And because of it, those are the very sick patients, and those are the patients who are likely to die from the disease. When you look at the deaths in our state, again, predominantly in the 65 and older age group, though we have had a few patients in younger age groups that have died recently. In my press handout that will be sent out, I highlight a couple of things that people have been interested in. One is influenza. The CDC has a very nice website that describes the differences between COVID-19 and influenza. And I think it's important to remember that the symptoms are quite similar. And so all of us in healthcare are strongly recommending that everybody 6 months of age and older receive the influenza vaccine this year, so we can reduce some of the confusion when a person comes in with upper respiratory infections around influenza or COVID. Remember, each year influenza increases the number of deaths in our state and it also increases hospitalizations. So anything we can do to reduce the number of influenza cases we have in our state is going to be very, very important. I can't overemphasize the importance of taking the influenza vaccine. The second point I want to make about influenza is that there is some evidence that if we do good at vaccination and we continue our COVID policies of wearing masks, doing hand hygiene and other things, studies from the Southern Hemisphere have shown that you can really blunt the severity of the flu pandemic that happens each year, or of the flu epidemic that occurs each year. And so we can reduce the number of cases. And a large study that came out of Brazil, again with 92,000 patients, that's in publication right now, basically showed that those people who had taken influenza vaccine seemed to get less ill when they had COVID-19. So that's still pending peer review, but I think it again just provides more evidence that it's important to get the influenza vaccine, and there is no evidence that it increases your susceptibility or causes any problems with respect to COVID. In fact, it may improve or reduce your likelihood of getting really sick with the disease. The second study that I highlighted today in my handout was an interesting one about using a supercomputer to evaluate the genetic material from multiple different specimens of COVID-19 from across the country. And they basically came up with alternative explanations for some of the severe complications and some of the common symptoms of COVID-19 that we see. And it's something called a bradykinin storm. Again, an overactive immune system releasing this chemical bradykinin, which causes many of the complications and some of the unique symptoms that we see with COVID-19. And that's the importance of that particular study, is that it explains some things that we've had difficulty explaining in the past. And so I thought it was an interesting study, and I put the link in the handout if people want to take a look at that. There is one symptom that's very common with COVID that you typically do not see with influenza, and that's loss of taste or smell. Loss of taste or smell is very, very specific to COVID-19, and it's one difference between influenza and COVID-19 that can help us differentiate the two different diseases. And then finally, I highlighted a study that was published in the journal JAMA Internal Medicine. It was a very interesting study that looked at 3,222 people who were hospitalized with COVID-19. They did not include any pregnant patients, but all of the patients in the study were between the ages of 18 and 34. So a young group of patients. And again, what it highlighted, though we know in Oklahoma that that age group is not very likely to be admitted in the hospital, when they are sick enough to get in the hospital, they can get very ill. And in this particular study, which was a U.S. study from 1,030 different U.S. hospitals, 20%, just over 20% of the patients who were admitted in that age group, 18 to 34, ended up in the intensive care unit. 10% of those patients ended up on a breathing machine, and 2.7% of the patients died. So again, hospitalization in this age group is not common, but when it does occur, and these people go into the hospital, they can become quite ill. The other thing the study showed was what are the risk factors for a young person to have those severe complications, and the primary ones were obesity and high blood pressure. That combination, obesity, high blood pressure, and if you add in diabetes, those young people had as much risk as older patients for the complications of COVID-19. So I thought it was an interesting study and an important one to remember. Again, thank goodness we don't see too many of those people that actually go into the hospital, but just recognize this is not a benign illness, and young people who get it can become very ill with it, particularly if they have underlying health factors.
Oh, that's so interesting. Since you had spent so much time talking about the flu, and we've had a lot of questions even as you were speaking, some questions would come in. I'm going to ask you those questions kind of in a group first. Some of them may be a little bit redundant, but might say it in your answer
Sure.
differently. So flu and allergy season. You know, of course, it's always allergy season in Oklahoma, but and you identified the taste and the smell as being some things that would help you know it was different, but every COVID patient doesn't necessarily have those, right?
Correct.
So when do you know it's something serious enough that you need to quarantine yourself because maybe it's not flu or?
Yeah, so I receive questions a lot from people who have some symptoms, perhaps allergic type symptoms, and they want to know, should I go get a COVID-19 test? And so I encourage anybody, if you think you've been around somebody with COVID or you're having other symptoms beyond just allergy symptoms like headache or muscle pains and things like that, please go get a COVID test because they're free, they're readily available. However, I had a question from a person this week that had a young person who had allergy type symptoms, which they'd had before. They had been in another location, but they hadn't been exposed to anybody known to be COVID-19. And most of the time in those circumstances, I recommend that you perhaps talk to your primary care doctor, but go ahead and try your usual treatment for your allergies. And if they get better, you don't necessarily have to go out and get tested. But certainly, if you do your usual treatment for your allergies and they don't get better, then I highly recommend that you go out and seek a COVID-19 test.
So they're wondering if how are do we expect that maybe the season is going to be since this may bring the flu season down in the extreme cases, but it's still there are hospitalizations during flu season. There's hospitalizations for COVID. Do hospitals across the state kind of expect even more of a pressure on them for patients coming in for these things?
Yeah, so the question is about capacity. Will we run any risk of hospital capacity issues during flu season with our ongoing pandemic for COVID-19? And yes, there is that possibility. I think all of our hospitals in our state are somewhat concerned that we could have some capacity issues if we see a bad outbreak of flu season along with what's happening right now with COVID-19. So I think we need to do things to prevent both. Wearing masks, hand hygiene, physical distancing prevent both COVID-19 and influenza, and we just cannot let the gas off. We have to do those things to slow the spread. Again, wearing a mask helps to prevent influenza. We probably should have been doing it for a long time. Second, there's no vaccine for COVID-19 yet, but there is for the flu. It's on the market now. It's available in many places. Please seek out a flu shot this year. Make sure you get one. Many hospitals, clinics, pharmacies, health departments will be administering flu vaccine. Please receive the flu vaccine. I actually got mine last week at the Student Union on the Norman OU campus as a part of the vaccination efforts for our students in Norman.
All right, let's go back to where you were talking about several days in a row of the 1,000, 1,100 cases a day. Are we attributing this spike to anything specific? Labor Day, schools back in session, or the reporting, the additional rapid antigen tests, or?
Well, so I've been asked that question a lot. What accounts for this rise in the number of cases recently? And one question I can't answer is what proportion of the new cases that are being reported that we didn't used to report are coming from rapid antigen tests, and I just don't know the answer to that question yet. I'm hoping that perhaps the health department or somebody can tell the difference between PCR testing and antigen testing. But remember, those were cases before we just didn't put them out in the daily numbers, so that may account for some of the increase. I think Labor Day, schools reopening, I think that there have been some activities that have potentially been events where we're seeing the spreading of the disease, like the correctional facilities, definitely accounts for it. So again, I highlighted on Monday alone, the state had 1,101 new cases, but it was just under 400 of those came from a single county in the state, which was Woodward County, where they have close to the Fort Supply Correctional Facility that accounted for a big chunk of the new cases in the state. So I know the state health department, the governor are implementing activities to try to slow the spread in correctional facilities. That's going to be really important that we do that.
So you've spoken before about this, being outside is going to be a little more safe than being inside. And now after like a day like yesterday where everybody was inside because it was raining all day, what do we, are we fearful that this fall is going to?
Yeah, so typically, remember, influenza actually circulates all the time in the population, but we see the big spikes in the fall and winter. Now, there's a number of theories for that, but one of them is that during the fall and winter months, particularly, we do less activities outside and we tend to congregate more in indoor settings, which increases the risk of person-to-person transmission of influenza. There may also be some evidence that actual humidity makes a difference with respect to influenza transmission, and that dry atmosphere that you typically will see during winter months may actually facilitate the transmission of influenza. But again, we see it's seasonal. We see it increase. Typically, the month that has the greatest number of influenza in a typical year is January, but sometimes we see it as early as December. So again, it's time to start thinking about getting your flu shot to help prevent influenza. No flu shot is perfect, but two big benefits of influenza vaccine. Number one, it definitely does prevent influenza in some patients. But secondly, if you get a flu shot, but then subsequently get the flu, you are much less likely to require hospitalization or get really sick with influenza. It actually seems to blunt the body's response to influenza so you don't get as sick. So two good reasons to get the flu shot.
I saw yesterday a lot online, and maybe it's an a week-old report, but the CDC had posted about some guidelines for Halloween. And I know you spoke about it last time we got together, but as it gets closer, is there anything new about Halloween we want to warn people about or prepare people about?
Well, so CDC this week came out with guidelines that basically said don't do Halloween, don't do trick-or-treating and things like that. And I understand the concern. I completely agree with them that you should not do any of these indoor Halloween parties. Definitely don't. You know, we used to do that because we felt like we were keeping them safer by doing this indoor party. This year, you may actually put them at greater risk by bringing them to an indoor event where they have a party related to Halloween. So I would strongly suggest not having any, quote, Halloween parties or anything. Again, CDC recommended against trick-or-treating. I think the only way that you can do trick-or-treating or other things and do it safely would be to make sure your child is, and any adults that are with them, are wearing a mask. I would encourage homeowners, if you're handing out treats, to wear a mask while you're interacting with those young people, and do it in very, very small groups. Don't go out in large groups where you're bringing people, again, close together, because that's how you increase the risk of infection. So a simple cloth mask underneath their Halloween mask would make it much safer, because not only does it stop the droplets coming out, but it might prevent them from inhaling something. But again, I want to highlight, CDC came out with their guidelines this week and basically said don't do Halloween this year.
Okay, I think you've covered everybody's questions. Anything that we want to leave everybody with?
Get your flu shot. They're available, whether it's your local pharmacy, the health department, your doctor's office, a hospital, a free flu clinic. You're going to see a lot of them open up soon. Please seek your flu shot, which will help all of us a lot.